Welcome back to Sunday House Call. Time now for Should I Worry? It's our weekly segment about everything that worries us. So this viewer asked, listen to these symptoms. I am a 67-year-old non-diabetic, very occasional drinker of alcohol, hardly drinks, with proportionate height and weight, but was recently diagnosed with fatty liver disease. Dr. Samadi, how does that happen?
Well, you know, that's a very interesting entity. Liver, as you know, is a big organ, one of the biggest ones we have in our system. 3 pounds, it's on the right side, and it's supposed to clear all the toxin, digest food, and store all the nutrients within. What happens in about 25% of Americans, incidental finding, you go for an ultrasound or you go for a CAT scan for some abdominal pain, and the doctor calls you and says you have fatty liver. This is a non-alcoholic fatty liver we're talking about, which is a case like this. He hasn't been drinking a lot of alcohol. And the risk factor for this is that 10% of your liver is filled up with fat. Diabetes, high cholesterol, high triglyceride, and obesity and overweight can lead to this. What do you do for someone like this? A lot of times your liver function test and your test could be completely normal and the doctor may not be aware of this. Sometimes it can lead to swelling of the liver, possibly cirrhosis, even though it's rare, and can cause a problem. So I think we just have to monitor this. I wouldn't really worry about this patient except like I would follow with the doctor to make sure that he's going to be okay.
It's called non-alcoholic fatty liver disease, and a lot of people have it, and the key there is non-alcoholic. But you know what? This is really important for me as an internist, because I see patients with elevated liver functions all the time, and a lot of internists will say, oh, it's the Lipitor, it's the Crestor. You can't do that. You got to look for hepatitis. You got to do an ultrasound of the liver to see if this fatty liver is there. The reason David just mentioned, it can sometimes progress. It also could become very severe, which is called NASH, non-alcoholic steatorrhea hepatitis. You know what? That is a leading cause of liver transplant in the United States, and 25% of the time that leads to liver failure and cirrhosis, where you get fatigued, where you get spider arteries on you, where you turn yellow, where your belly swells. So I don't want to scare people out there, but if your liver functions are going up, don't let some physician say, oh, it's the medicines you're on. It's got to be investigated. Could it be hepatitis? The fact that you're not a drinker is the key here, because if you're a drinker, that may be...
His weight's in control and everything.
Yeah, he doesn't have the common causes we're looking for. But I have to tell you, Arthel, I see this a lot. I see a lot where I see fatty liver and I don't have a cause.
And
but guess what?
Do you have the same symptoms, though?
Well, the worst, there are severe examples of this. It can be very mild, and where I just follow it, or it can be very severe. Now, in all cases, I would involve a liver specialist. I wouldn't just follow it myself. Get a liver specialist. Follow serial ultrasounds. Make sure it doesn't get worse. Make sure that you don't develop cirrhosis, which is what David pointed at the beginning. That's serious liver damage. That may need you to have a liver transplant.
Well, what's interesting is, like, you know, when we treat prostate cancer patients and they get these CAT scans and studies before they go to the operating room, this is an incidental finding that we see in the liver. Now, I personally don't treat fatty liver. What I tell them is make sure that you watch your cholesterol, you watch your weight, and you watch, you know, your triglyceride. They don't necessarily need to go to see, right?
That's a great point. On top of that, I forgot to mention, you change your diet. Also, even if you're not a big drinker, get rid of alcohol at that point. Because even if alcohol didn't cause it, alcohol can make it worse.
Yes or no?
And
fatty liver can be reversed.
Tylenol.
Can fatty liver be reversed? Yes or no?
You can control it and you can stop it. And ultimately, it won't be a big problem for you.
It can be reversed.
Yes.
All right. A lot of it can be reversed with diet.
Okay.